Ready for another deep dive. Today we're talking about something we all experience but don't always give enough attention. Eye pain. And you've sent us some really interesting research on this. It's way more than just like dry eyes from staring at our screens all day.
It's true. It's really easy to just kind of brush off eye pain as no big deal. But the stuff you shared, it actually highlights this really crucial difference between when it's just annoying and when it's a sign of a bigger problem.
Yeah, the first thing that jumped out at me was that whole ocular versus orbital pain thing. Sounds kind of complicated at first, but I feel like once you get it, it makes total sense.
It's all about location, really. Ocular pain is all about the surface of your eye. So think that itchy feeling you get when you've got allergies, or maybe like a rogue eyelash that's decided to go rogue.
Hmm.
Annoying, sure, but rarely a reason to freak out, medically speaking.
Okay, so then orbital pain is like the next level up.
Yeah, exactly. This time we're talking about pain that feels a lot deeper, like it's coming from inside the eye itself. And that usually means something else is going on that needs a doctor to check out, like maybe inflammation of the optic nerve, or in really rare cases, even a tumor.
See, now that you mention it, I do remember reading about that. Definitely made me pay attention. But for our listener who's like, okay, when should I actually be worried? How do you know it's time to see a doctor?
That is the million-dollar question. The good news is those sources you sent do a nice job of spelling out those red flags. Like if you've got really severe pain that just won't quit, that's a big one. Also, any sudden changes to your vision, so things like blurriness, seeing double, or even if you start seeing halos around lights.
Oh, right. And I mean, this probably goes without saying, but if your eye is like fire truck red, super swollen, maybe you even see some stuff oozing out, call a doctor, right?
You got it. It's amazing how many people will brush off even those super obvious signs. Oh, it's just a little red, it'll go away. But even things that seem minor, like remember that article about contact lens irritation? That can turn into a huge pain if you just ignore it.
Ugh, speaking of contacts, gotta confess something. Sometimes when I'm really tired, I just crash without taking them out. How bad is that, really?
Let's just say it's not exactly doing your eyes any favors. Even if you think your contacts are squeaky clean, they can still be a breeding ground for bacteria. And bacteria love throwing parties in your eyes, which usually means, yep, pain and infection.
Okay, you win. Glasses before bed from now on, promise.
Hmm.
But going back to common causes for a sec, conjunctivitis and those corneal abrasions really stood out. Those are things most people have dealt with at some point, I'd guess.
Oh, absolutely. Conjunctivitis, or as most people call it, pink eye, that's everywhere, especially with kids. Spreads like wildfire in schools and daycares because, kids.
Oh, yeah, I remember those outbreaks. Pink eye was practically a rite of passage in elementary school.
Totally. And while it's usually caused by a virus, it can also be bacterial or even because of allergies. Point is, got to figure out what's causing it so you treat it right.
Makes sense. And then corneal abrasions, that's basically a fancy way of saying you scratched your eye. I've done that a few times, usually by accidentally poking myself. Talk about a special kind of ouch.
And even though those scratches might seem minor, you don't want to mess around with them. The cornea, that clear part at the front of your eye, it's super sensitive and super important for seeing clearly. So yeah, any damage there, get it checked out.
Okay, so we've covered some of the more common, less scary causes of eye pain. But let's be real, sometimes it can be a sign of something way more serious.
Definitely. The research you give us gets into conditions like glaucoma and optic neuritis, which, if you don't treat them, they can really mess with your vision long term. That's where really understanding what your eye pain is trying to tell you is so important.
All right, let's break those down a bit because they both sound kind of intimidating. Starting with glaucoma, what is it exactly and why is it such a big deal? So glaucoma, you were saying it can really mess with your vision if you don't catch it in time. What's actually going on in the eye when someone has glaucoma?
Glaucoma is kind of sneaky. It's often called the silent thief of sight because it can be happening in the background for years and you might not even realize it. Basically, it's a bunch of different eye conditions that end up damaging the optic nerve, which is what carries all the visual information from your eye back to your brain.
So you could be losing your sight and not even know it until it's like way too late.
Exactly. That's why those regular eye exams are so important, especially as you get older. Catching it early is key because if you start treatment early enough, you can usually slow it down, maybe even stop it completely.
Okay, yeah, that's definitely going on my to-do list after we're done here. Schedule that eye exam, check. Now, what about optic neuritis? That one sounded pretty scary.
It does sound kind of intense, but actually, in a lot of cases, it gets better either on its own or with the right treatment. So with optic neuritis, we're talking about inflammation of the optic nerve, that same nerve we were just talking about with glaucoma. You might have pain, your vision might get blurry for a bit. Some people even experience temporary blindness in that eye.
And I remember one of the sources mentioned corticosteroids as a treatment option.
Yeah.
How do those work for optic neuritis?
Corticosteroids are basically like inflammation-fighting ninjas. They go in and calm down all that swelling in the optic nerve, which helps with the pain and can also help your vision get back to normal. Think of it like there's a fire that's messing up the communication lines between your eye and your brain, and the corticosteroids come in to put the fire out.
Okay, that makes sense. We've been talking about some pretty serious stuff. How about we lighten things up a bit and talk about migraines? I always think of the headache part, but eye pain can be a factor there too, right?
Oh, totally. Migraines are wild, like a whole neurological adventure. And while they're not specifically an eye problem, they can definitely come with a bunch of different symptoms, including that pounding headache, pain in your face, and yep, even in your eyes.
And what about those weird visual things some people get before or during a migraine, like the flashing lights or whatever? Those are connected to the eye pain too.
Great question. It just shows how interconnected everything in our bodies really is. So those visual disturbances, they're called auras, and yeah, they're a classic migraine thing. Basically, what's happening is the migraine is messing with how your brain normally works, and that includes the parts of your brain that are in charge of processing everything you see.
So like a temporary glitch in the visual system.
Exactly. And here's the thing, those auras, they can show up before the headache hits, during the headache, or even without a headache at all. Migraines are weird, man.
No kidding. Okay, so we've covered serious eye conditions, even migraines. But what about those times when you just need a quick fix for something minor? Do those home remedies we always hear about actually do anything?
You know, for those everyday annoyances, those home remedies can be surprisingly helpful. Like if you've got a sty, which is just a clogged oil gland in your eyelid, a warm compress can work wonders.
Yeah, makes sense. The heat probably helps to loosen things up and get things flowing again. What about when you get something stuck in your eye, like some dust or an eyelash?
Flushing it out with some clean water or a saline solution, that's usually your best bet. Just remember to be gentle. And this goes back to what we were talking about earlier with the contact lenses. If you wear them, definitely take them out and give them a good clean after you've had any kind of eye irritation.
All right. Hygiene is key.
Mhm.
But honestly, sometimes it feels like no matter what I do, my eyes are just tired and strained, especially with how much time we all spend staring at screens.
That's definitely a thing these days with all the technology we're glued to. Honestly, sometimes the best thing you can do is also the simplest. Rest.
You make it sound so easy.
It really can be. Make sure you're taking breaks from your screen, and have you heard of the 20-20-20 rule?
I have, but I'm sure our listeners wouldn't mind a refresher.
It's a great way to give your eyes a break. So every 20 minutes, take a break and look at something at least 20 feet away for 20 seconds. Simple, but effective.
Totally doable. But what about when those simple things just don't cut it? When is it really time to get your eyes checked out by a professional?
That's when those red flags we were talking about before become super important. So any big changes in your vision, really persistent pain, anything weird coming out of your eye, those are all signs to get it checked out.
Basically, better safe than sorry, right?
Yeah.
When in doubt, go see a doctor.
100%. The good news is there are so many effective treatments out there these days, from antibiotics if you've got an infection to those corticosteroids for inflammation. And in some cases, you might even need surgery.
Whoa, surgery on your eyes. I'm not gonna lie, that sounds a little intense.
It's not usually the first line of treatment, but it's good to know that eye surgery has gotten incredibly advanced. They can do everything from laser surgery to get rid of cataracts to super complex procedures if there's damage from an injury or a disease.
Wow, I had no idea. Well, speaking of amazing things our eyes can do, let's talk about prevention for a bit. I mean, it's always better to avoid eye pain in the first place, right?
Absolutely. And it's often easier than you think.
All right, spill the secrets. What can we do to keep our eyes healthy and pain-free?
It really starts with some simple habits. Like if you're doing yard work, playing sports, anything where something could fly up and hit your eye, wear protective eyewear.
Ugh, yeah, learned that one the hard way. Got whacked in the eye by a rogue tree branch while I was trimming some bushes. Safety glasses all the way now.
Smart move. And it's not just about protecting ourselves either. Think about kids got to make sure they're playing with age-appropriate toys that aren't going to put their eyes at risk.
So true. Those toys that shoot things. Recipe for disaster.
Right. And while we're on the topic of potential hazards, let's not forget about chemicals, cleaning products, anything like that. Always wear eye protection if you're working with something strong, and obviously keep that stuff out of reach of kids.
Those are all such practical tips. It's making me realize something. We've been so focused on the physical stuff, but what about how eye pain can affect you mentally and emotionally?
That is such an important point, and it's something that often gets overlooked. Any kind of chronic pain, and that includes eye pain, can really wear you down over time.
It's easy to just think about, like, the physical discomfort, but yeah, the emotional and psychological toll that chronic eye pain can take is real.
It really is. It can impact everything: your mood, how well you sleep, your overall quality of life. I mean, imagine dealing with eye pain all the time. Even simple things can start to feel impossible.
Yeah, it's like this weight you're carrying around that affects your work, your relationships, everything. And for some people, it's just their reality, day in and day out.
Exactly. We have to acknowledge that mental and emotional side of chronic eye pain. Encourage people to talk about it and to get support if they need it.
Because no one should have to go through that alone, and there are resources out there that can help.
Absolutely. Sometimes just finding other people who get it, who understand what you're dealing with, that can make all the difference. Just knowing you're not alone is huge.
It's all about finding that community, that support system, right?
Yeah.
People who get it.
Exactly. And just like we talk about regular eye exams for your physical eye health, it's just as important to make time for your mental and emotional well-being, especially when you're dealing with chronic pain.
So true. Well, I think we've given our listeners a lot to think about today. Hopefully they've got a whole new appreciation for their eyes now.
It's been pretty eye-opening, even for me.
It really has. But before we go, we always like to leave everyone with something extra to chew on, something to maybe spark some more thinking about everything we talked about today.
The sign of a good deep dive: always leave them wanting more.
Exactly. So here it is. We've gone deep into the world of eye pain, all the different causes, what you can do about it, even that psychological impact we were just talking about. But what about technology's role in all of this? I mean, let's be real. We are glued to our screens these days. Could there be a connection between all that screen time and how many people have eye strain, dry eyes, even pain? And if so, what can we do about it? Give you something to think about while you're scrolling through your phone later tonight.
Well, that is a question. Makes you wonder what we'll learn as we study this stuff even more, especially as technology keeps changing so fast.
Right. And on that note, I think that's a wrap for today. Thanks for joining us for this deep dive into the wild world of eye pain. And remember, when it comes to your health, knowledge is power. So take care of those amazing eyes of yours, and we'll catch you next time for another deep dive.